Imagine having to choose between buying your children's medicine or paying rent. For millions in America, this isn't a hypothetical, it is the reality. But why? Today, we're breaking down the root causes of healthcare inequality using data to uncover solutions that can work for everyone. Welcome to DataRx. I'm Casey, and I'm here to help you understand the biggest challenges in healthcare and how we can solve them together using data and technology.
Today, we will be looking at the $12,434 question. We will be looking at AI, how that is a tool, not a fix. And finally, we will be looking at what you can do to drive change.
Today's question: why does the United States spend more on healthcare than any other country, but still we rank 34th in life expectancy? Let's start by following the money. You might be surprised where it leads us. Let's break this down. In 2022, the United States spent $12,434 per person on healthcare. That is double what Japan spends. And yet, people in Japan live nearly 8 years longer on average. So, where's all the extra money going? Since 2017, our spending has increased by 26%, but outcomes haven't improved. This isn't just inefficiency, it's inequity. Let me introduce you to Maria. She's a teacher who pays $200 a month for her insulin. Sometimes she has to choose between buying groceries and keeping her diabetes under control. Then there's James, who delayed a cancer scan because he couldn't afford his $1,000 deductible. These aren't just isolated cases. They represent millions of people who are falling through the cracks of a broken system. And when someone delays care, it often leads to bigger health problems down the line, problems that cost even more to treat.
This isn't just a spending issue. It's a question of whether our system is designed to help everyone or just those at the top. Maria and James aren't the only ones making impossible choices. Let's take a step back and look at the bigger picture. When we break down healthcare spending by income groups, we see just how deeply the inequity runs. Families in the lowest income category spend an average of 23.6% of their annual income on healthcare. Imagine that. Nearly a quarter of their income just to get the care they need. Even in the low middle income group, families are spending 17% of their earnings on healthcare. Meanwhile, those in the middle income category spend 8%, and at the top, the wealthiest families spend just under 5%. Now consider this. Maria's insulin isn't optional. James' cancer screening isn't optional. But for families living paycheck to paycheck, healthcare often feels like a luxury they can't afford. Until we address the way healthcare costs hit low-income families the hardest, we'll continue to see stories like Maria and James, and they won't be rare, they'll be the norm.
Let that sink in. The same system is supposed to work for everyone, but clearly it doesn't. And it's not just about general spending. Consider this. The United States pays up to 10 times what European countries pay for the same pharmaceutical drug. For example, insulin, a life-saving medication for diabetes, can cost hundreds per month in the United States, while costing a fraction of that in Europe. Why? Because pharmaceutical companies here can set prices with minimal regulation. AI often gets hyped as a magic fix, but here's the truth. AI is just a tool. Think of it as a flashlight. It can highlight problems, but it can't solve them on its own. One of the biggest areas where AI can help is in reducing administrative costs, which make up 25% of United States healthcare spending. At Stanford, AI reduced billing errors by 40%, saving hospitals millions of dollars. That's money that could be spent on patient care. AI isn't perfect. It needs human oversight, or we risk making things worse for people who are already struggling. The United States recently committed to $500 billion in AI research. But here's the question: how much of that will actually go towards improving healthcare access? Should we be building more robots or developing tools that help nurses and doctors give better care? This is why I believe we need to focus on equity-driven AI solutions, ones that prioritize people, not profit. Now, I know all of this sounds overwhelming, but change is possible, and it starts with small steps that we can take together. Here's how you can help. Share this video on social media or within your network. Awareness is the first step towards creating collective pressure for change. Learn to spot misinformation. Equip yourself with data literacy to identify misleading claims about healthcare funding and policy. Free resources are linked in the description to help you build this skill. Engage in local action. Join or support local organizations advocating for affordable and equitable care. Community level change often sparks broader systemic reform. Fourth, and finally, participate in surveys and petitions. Many petitions and policy feedback forms directly influence decisions. Make sure to engage in them. AI and data-driven solutions can be part of the answer, but only if we steer them in the right direction. Let's demand technology that benefits everyone, not just the privileged few. You have just leveled up your knowledge, and that's the first step to making a difference. If you found this video helpful, hit like, subscribe, and share it with someone who needs to hear this. Let's heal this system together.